Do you or a loved one suffer from severe chest pain that constantly seems to interrupt your daily routine? Have you ever had a feeling of pressure, tightness, or heaviness in your chest? Well, we have the solution for you. Try nitroglycerin sublingual or Nitrostat. Nitroglycerin can relieve or treat chest pain. With this medication, the blood supply to your heart will surely be flowing again soon. Nitroglycerin usual dosage is 0.3 to 0.6 milligrams and can be taken up to 3 times within a span of 10 minutes. When taking nitroglycerin, your mouth should be completely empty and you should not be chewing on anything else. Nitroglycerin should be placed under the tongue and you must let the medication dissolve fully. It is important to know that nitroglycerin must not be crushed, swallowed, or chewed on, as doing so will render the medication. It is imperative that 911 and emergency services be called if pain doesn't subside after the first dose of nitroglycerin. While waiting for emergency services, it is advised to take a second dose of nitroglycerin 5 minutes after your first dose and a third one 5 minutes after your second dose. It is also important to prevent tolerance of nitroglycerin, and other nitrates should be used in the lowest effective dosages. Tell your doctor if you are pregnant or plan to become pregnant. Do not take nitroglycerin if you are taking erectile dysfunction medication, as it can cause a sudden and serious decrease in blood pressure. It is also advised to not take nitroglycerin with other hypotensive drugs. Exercise caution when taking nitro with a beta blocker, calcium channel, and diuretics, as these medications can lower blood pressure. Also, do not take nitroglycerin with alcohol. Vasodilation can occur rapidly. Tolerance can be reversed by withholding nitrates for a short time. Initial therapy can produce severe headaches. Long-acting preparation should be discontinued slowly. Side effects may include bloating or swelling of the face, arms, hands, lower legs, or feet, a burning, crawling, itching, numbness, prickling, pins and needles, or tingling sensations, difficult or labored breathing, feeling faint, dizzy, or lightheadedness, a feeling of warmth or heat, flushing or redness of the skin, especially on the face and neck, headache, rapid weight gain, sweating, tightness in the chest, tingling of the hands and feet, unusual weight gain or loss. Talk to your doctor if you think nitroglycerin might be right for you.
Can you grab my nitroglycerin in my bag? It's just like that bottle right there.
Yeah, sure. What is this used for?
Thanks. It's just used to relieve like my chest pain. Sometimes I get really bad chest pain.
How does it work though?
Y'all, I'm just gonna film a nursing video on it because y'all need to know. Hi class, this is Professor Royer here, and today we are gonna be talking about nitroglycerin sublingual tablets. Nitroglycerin sublingual works by vasoconstricting the blood vessels, increasing the blood supply to the heart tissue, and decreasing the workload.
Make sure your patient is seated before administering nitroglycerin. Maintain baseline vital signs, paying close attention to systolic blood pressure as it cannot be greater than 90. Make sure your patient is on a cardiac monitor. To administer this medication, place 1 tablet under your patient's tongue or inside their cheek and let it dissolve. Make sure your patient does not chew or swallow the medication and does not rinse their mouth out. Constantly monitor their blood pressure and their chest pain. Before giving nitroglycerin, confirm that your patient is not allergic to nitroglycerin, have not recently taken a phosphodiesterase inhibitor like sildenafil, which could lead to severe hypotension and possible death.
As a nurse, expect to see increased facial flushing, some redness, some swelling, maybe even some burning tingling under the tongue, headache. As a nurse, notify the physician of your patient. Make sure to follow the chest pain protocols. Are you okay?
Sublingual nitroglycerin comes in a dark vial because it is very sensitive and should not come into contact with light, heat, or moisture. When storing this medication, it is recommended to store it in a dry place at room temperature, keeping the container tightly closed after each use. Nitroglycerin is only good for 3 months after the bottle is open. Before administering nitroglycerin, make sure you perform hand hygiene and go over the 5 rights of medication administration: the right patient, the right drug, the right dose, the right route, and the right time. Wait 5 minutes after giving the first dose of nitroglycerin. If your patient is still having chest pain and their systolic blood pressure is still within range, you may give a second dose and then a third dose after another 5 minutes. Do not give more than 3 doses.